and welcome to Here's to Your Health. I'm your host, VeggiePatti, and it is my pleasure to bring you information on healthy living. On today's episode, I have a very special guest. I would like to introduce you to Katherine Radakovich. She's actually my sister, but she's also a nurse practitioner and a registered dietitian, so I wanted to invite her on the show and share some of her knowledge with you. So thank you for being on the show, Katherine.
Thanks for inviting me.
So today's show is what everyone should know about type 2 diabetes. And as part of your practice of when you were doing registered dietitian work and also as nurse practitioner, you do a lot of diabetes education with your clients. So I wanted you to share that knowledge with the viewers here. So can you tell us first of all, what is diabetes?
Diabetes is a condition or a disease where the blood sugar level gets too high. And that high blood sugar causes a lot of different problems in the body. There are different types of diabetes, of course, but all of them, the common denominator is the high blood sugar.
Okay. So now on this show we're going to focus on type 2 diabetes, but can you just explain the different types of diabetes? I know people hear type 1, type 2, juvenile diabetes, gestational diabetes, and I'm not sure if there's any others. So.
Okay. When most people hear diabetes, they think of what we now call type 1 diabetes, which is the same as juvenile diabetes. That's an older term that's been replaced by type 1. But in fact, only about 5% of people that have diabetes have this type of diabetes. Type 1 diabetes is actually where the pancreas no longer is making insulin. And so these people with type 1 diabetes have to take insulin through an injection.
Okay. And what about gestational diabetes?
Gestational diabetes is during pregnancy. It's difficult to know exactly why gestational diabetes happens because it happens in women that have never had diabetes before. It generally happens after the baby is pretty well formed, just hasn't grown completely yet. And suddenly the blood sugar starts to become very high and they start to become very insulin resistant, which we'll talk about later, and their needs for insulin go way up. They're much higher. So they generally also have to take injections as well as watch their diet and activity. Okay,
and so like I said, this show is focusing on type 2 diabetes.
Mm-hmm.
So what is type 2 diabetes?
Type 2 diabetes is the most common kind of diabetes. It results in high blood sugar. The causes of it, we're not entirely sure, but we know the two main causes are genetics and lifestyle factors. So when I say lifestyle factors, primarily I'm talking about diet and exercise.
Okay. And so that was one of the reasons why I wanted to have you on the show, is because type 2 diabetes is definitely something that people do have some level of control over because of the lifestyle component, correct?
That is very true. That's actually one of the very positive messages about diabetes, particularly type 2 diabetes, is that you have a lot of impact through your choices as to the outcome. Certainly we can't control everything. There is a genetic component, and many people do need medication. Some need insulin even with type 2 diabetes. But no matter what type of medical treatment they need, the basis for the treatment is always diet and exercise.
Okay, and then there are people, though, with type 2 diabetes that have been able to successfully manage their diabetes with just the diet and exercise, so they no longer need to take insulin, correct?
That is true. Generally, people with type 2 diabetes are given oral medication first, and there are definitely people who have made significant lifestyle changes. They're leading a very healthy lifestyle. They've changed their diet, they've increased their exercise, they've reduced their insulin resistance, which is the main cause of the type 2 diabetes. And many people have been able to come off or reduce their medications. And even more importantly, many people have prevented progressing to diabetes with the lifestyle changes. We do know that diabetes is extremely common. By the time you get to be 65 or older, more than a quarter of people have type 2 diabetes. But even more than that number, people have pre-diabetes. So this is high blood sugar levels not high enough to be called diabetes, but we know the next step is diabetes. And so those people in particular, the lifestyle changes can prevent the progression to diabetes, or extend that time for many, many years.
Okay. So can you explain what happens to the body or inside the body with diabetes? I know when we were talking before the show, one of the things you said that I found interesting was that you said it actually ends up being a disease of the blood vessels.
Yes.
So can you just, like I said, explain what does diabetes do to the body?
The high blood sugar levels. What I usually talk to my patients about, whether I have my dietitian nutritionist hat on or my nurse practitioner hat on, is that I always ask them to envision, when you were a kid, you were probably bored at a restaurant at some point and kept dumping sugar into a glass of water. I think we've all probably done that, stirred it, and at some point that sugar no longer mixed in anymore, and it became a very thick, scratchy, crystalline type of a solution. That's literally what happens in the bloodstream. So when we eat food, all of our carbohydrates are digested, they get broken down into sugars, and they get absorbed into the bloodstream. People with diabetes and type 2 diabetes, because they don't have insulin or insulin that works well, that's the insulin resistance, the sugar gets stuck in the blood. So it goes up and up, much higher, until it gets to the point where it's literally, your blood becomes a thicker, crystalline, scratchy solution. And so you imagine how hard it is for the heart to pump that through all the blood vessels, how much damage that rough crystalline solution, the blood, can do to especially the small vessels. So you see a lot of the end result of that are things, the scary things that we hear about with diabetes: damage to the eyes, damage to the nerves, but it definitely affects the cardiovascular system, and anything that's attached to a small blood vessel, which is everything in the body, can be affected by high blood sugars that are not well controlled.
Okay. Yeah, like I said, I find that very interesting. Is people don't think of it that way with diabetes. They just think, well, I have high blood sugar, so maybe I don't feel good, or maybe I get dizzy, or or something. But they don't think of it as actually doing internal damage to their blood vessels by having this sugar solution actually scraping up against their blood vessels.
Right. And what you just said is actually very common. A lot of people think, oh, it's not that big of a deal, it's just a little bit of high blood sugar. But it actually is a very big deal. We know that rates of heart attack and stroke are much higher in people with diabetes, especially if it's not controlled. Dementia increases, depression decreases, so many things. So it's very important to pay attention and not think of it as, oh, I just have a little bit of diabetes. There's not really such a thing.
Okay. So you mentioned a little bit about insulin resistance. Can you explain what is that, how is that related to diabetes, and what does that do to the body?
Right. We did already mention that in order for your blood sugar to be controlled, you need insulin, and insulin that works well. So we probably all learned this in science class a long time ago, may remember it or not, but we eat food, carbohydrates turn into blood sugar, your pancreas senses that and puts out some insulin into the bloodstream. And that should match up with your blood sugar. They sort of travel together to every cell in your body because your entire body needs that blood sugar, or glucose, you'll hear it called that sometimes too, needs that as fuel. That's its energy. But somehow it's got to get into every cell. So that's what insulin's job is. Your pancreas puts out the appropriate amount, matches the blood sugar, and that insulin it actually has sort of a docking station, a receptor on every cell. Once that matches up, the blood sugar is allowed to go into the cell and be used for fuel.
So it's kind of like a key that opens the door to
exactly.
the cells.
That's a very common analogy that many people use, and that's a good analogy. The problem with insulin resistance is that those receptors, or that lock that you talked about, the key, which is the insulin, no longer fits properly into that lock. So what happens is your insulin is there, but it's not working right, and your body's not recognizing it like it used to. That is insulin resistance. And the causes of insulin resistance are genetics and lifestyle factors. So you could be eating too many things that turn into blood sugar and your blood sugar is high, but also lack of physical activity causes those receptors to not be the right shape anymore. So when you do things like exercise, it can correct that and cause your insulin to work better.
Okay, and we're going to talk about how the right food and exercise actually can impact that and what that does for the body in a minute. But when you say insulin, so the insulin doesn't work anymore and it's not doing its jobs, is that when the body produces more insulin then?
That's exactly when that happens. So your body has many mechanisms by which to compensate when things start to go wrong. So insulin resistance is one of those times when things are starting to go wrong. You've got this blood sugar hanging out in the bloodstream. Your cells want to use that. Your body wants to get it in there. So your pancreas starts to put out some extra insulin because your body's probably thinking, it didn't get the message, so let me try again. So you're getting higher and higher levels of insulin, and for a time, that can compensate, and you can start to use your blood sugar. There are some issues that come up with that. Insulin is a hormone. It's a storage hormone. So people often start to gain weight, and they have a lot of trouble losing weight. Not only is all that sugar, those calories, getting into the body, but the insulin's also signaling to the body that you need to store, that you need to make, stores of energy, which of course we store as fat. And so people tend to have a lot of trouble losing weight.
Okay. So can we talk then a little bit about what are the symptoms of somebody who has diabetes or who has pre-diabetes? Because I know, so when we talked earlier, you had mentioned a statistic that I was surprised by. You said it takes 8 to 10 years before somebody's actually diagnosed with diabetes.
Right. That is actually improving, but from the time someone actually has diabetes or pre-diabetes, the average time for diagnosis tends to be about 8 years. That's a really long time. That's a long time where somebody doesn't know. That's a long time where gradually the blood sugar is getting higher. That's a really long time where someone's not feeling well. And the symptoms they tend to have tend to be progressive, and people tend to say, oh, I'm getting older. Or, they don't notice how slowly it's creeping up on them. So the things to look for, the most common symptoms that patients have told me about, being thirsty all the time, being really tired. And you can understand why that would happen. If your blood is full of sugar and it's that thick, viscous solution, your body wants to dilute it. You want to drink and drink and drink. They're usually going to the bathroom all the time because they're drinking so much. It's a way for your body to sort of flush some of that out, dilute that high sugar in the blood. And also they feel very tired, because think about how hard it is for the body to process all that sugar and to move that thicker blood around. People just feel very, very tired. Those are the most common things. But other symptoms that they can have are blurry vision. That's also really common. Tingling in the hands and feet sometimes if the blood sugar's been quite high for a long time. Skin changes, a lot of really dry, itchy skin. It might take a lot longer to get over a cold than it used to. If you get a cut, it might take longer for that to heal. There's not as much room in the blood anymore for all the good stuff because there's so much sugar in there. So people start to notice these things, but they sort of become the new norm, so they don't pay a lot of attention. But it's important. It's important to start paying attention.
I think a lot of people have heard that, especially with the thirst, the excessive thirst, and then the excessive urination that goes along with that. And you would think that people would go to the doctor and, think, okay, I'll just get a blood test and they'll tell me if I have diabetes. So why would it go for so long being undiagnosed? Are people just not going to the doctor because they just think it's normal?
Right. Many people aren't. Many people aren't going for various reasons. Could be they don't have the time, they don't have the insurance. There are many reasons. They don't want to know. That's a big one. Somebody in their family might have diabetes and they just aren't ready to go there yet. That's really common. But a lot of times people just really don't think something's really wrong with them. We have that tendency. We all see ourselves as pretty healthy people, and you can be with diabetes, but nobody wants that diagnosis.
Okay.
So that's a very common thing. The other thing too is that often people are going. they don't mention these things all the time because they think, well, why am I going to complain that I'm tired, right? They hear that all the time. Or they might even be getting blood work done, but their blood work's usually done when they haven't eaten for 12 hours. And in the early stage of diabetes, your body's still pretty good at processing that sugar over time. So within that 12-hour period from when you ate till when you had your blood drawn, it might not be high. But if you were to check your blood sugar after a meal, a couple hours after a meal, it could in fact be very high. But it might look okay for many years if you're only checking it in the morning.
Okay. So now you brought some foods here to demonstrate how much sugar is actually in food. So first, before we talk about these foods, can you explain about a carbohydrate? Because you had mentioned that it's when you eat the carbohydrates that's, turns into sugar and glucose in the body. So what is a carbohydrate?
Well, a carbohydrate is a type of food. There's just three basic macronutrients: carbohydrates, fats, and proteins. So all of the carbohydrates, which is actually what I've got out here, and some of these things people are going to be very aware of, others might be a surprise. The carbohydrates are chains of sugars that the body breaks down into individual simple sugars and absorbs and uses for energy. We all need some carbohydrate to make energy. So I am not suggesting at all that people with diabetes or insulin resistance stop eating carbohydrates. It's just eating an appropriate amount, and you can work with your healthcare provider or dietitian to find out the exact right amount for you if you have diabetes. These are just general guidelines.
Okay, so what are some of the things that you brought?
Okay, so all of the foods that I have out here are considered to be carbohydrates. They are carbohydrates.
Except for the
cucumber juice. So these things will be broken down, digested, and turn into sugar in the body. So some of the things everybody knows. People think, okay, I have diabetes, I can't eat sugar anymore. So we've definitely got some sugar out here, and this is a tablespoon of sugar. But most people don't know that this tablespoon of sugar in the body is really equal to that piece of bread, whether it's white bread or wheat bread. This piece of bread gets broken down into this much sugar. This is actually a rather large tortilla, but the smaller tortilla is also equal to this tablespoon of sugar, this piece of bread. One thing that surprises some people is fruit, because we always say, eat more fruits and vegetables, and that is true. From the carbohydrates, you certainly need to make smart choices, and fruit is one of those smarter choices, but you do have to know that fruit becomes blood sugar. Another surprise to a lot of people is milk. A cup of milk turns into the same amount of sugar as this tablespoon. So I'm not saying that these are unhealthy foods, just that they do become blood sugar, and people with diabetes have to be aware of how much of these things they're eating. Other things that, that you might not know are yogurt. So about a cup of yogurt, plain yogurt. Certainly if you get the fruit and the sweetened one, that's going to be quite a bit more. Cooked starches, like cooked cereals, this is oatmeal. I filled it up with dry just so we could avoid a mess, but half a cup cooked, after it's cooked, measuring it at a half a cup, is the same as an apple or this. And starchy vegetables, everybody's heard of potatoes, sweet potatoes, corn, peas. Those are all starchy vegetables. They will become blood sugar eventually. One thing that I think it's important to mention is that some things become blood sugar faster than other things, right? So you can imagine that if you were eating an apple versus drinking a half of a cup of apple juice, which one's going to go into the blood quicker and cause your blood sugar to get higher faster? Definitely the apple juice.
Right.
So you can make smarter choices.
Right. And we've talked about that in some of my other shows. It's the fiber slows down the absorption of the sugar in the bloodstream.
Right. Another thing to know is that sugary drinks have actually been tied to increased rates of diabetes. So soda pop, we know that drinking a lot of soda pop, you definitely have higher rates of diabetes. Recently, it's been found that drinking a lot of fruit juice also. We think of fruit juice as being very healthy for us, but it is sugar, and it has the same amount of sugar as pop. So, while you do get some vitamin C and some other nutrients in choosing that over soda, for your blood sugar, it actually ends up equal. And I recently read that I think it's a 20% increase in diabetes in people who are regularly drinking a lot of juice, of fruit juice.
Okay.
I actually brought this bottle right here to show how much sugar is in about a 20 to 24 ounce bottle, which is the typical size you get. This is almost a quarter of a cup of sugar. Whether it's juice or soda pop, we always think, oh, it's a natural sugar, but it still becomes blood sugar. So it's important, and that's a lot. We don't realize we're drinking that much sugar in our drinks.
So now, what can people do about it? What can they do as far as diet, and what can they do as far as exercise? And I know that they should consult their physician, but just as some general advice, what are things people can do?
Right, and it is important that people talk to their healthcare provider or their dietitian to get specific advice for them, because everybody's a little bit different, and some of these things vary. Timing of meals might vary with the type of medications that you take. So it's all important. But in general, a place to start is making sure that you're adding more non-starchy foods that are high in nutrients. So that would be vegetables, non-starchy vegetables. I usually ask people to envision a plate. And you've been to a picnic before where you had the divided plate where it was a half and then 2 quarters. Half that plate at your lunch and your dinner should be non-starchy vegetables. That should be the base for your meal. And one of those smaller portions can be a protein and a starch. That's a good place to start, a good place to think about it. And these are not guidelines just for diabetes. This is guidelines for a healthy lifestyle for everybody.
Now, what about exercise? And can you, with exercise, can you explain how you said, like, with exercise, it actually helps to change the insulin receptors? So
Yes.
how does exercise do that, and what types of exercise?
Okay. All types of exercise are good. All types of exercise are burning off energy, calories. We know that. So that means your body's going to be utilizing more of your blood sugar during that time. But we do know that when you use your muscles, it actually is really beneficial to do some strength building exercises where you're actually building muscle, but even walking would be good. So whenever you use your muscle, it seems to correct the shape of that insulin receptor a little bit, and over time it can improve, so it can reduce your insulin resistance. So exercise is actually important daily for people with diabetes, and it works right now. It works for about 24 hours, and it works in the long term to lower blood sugar. So we all know we're burning off more sugar and energy when we're doing exercise right now. But those muscles tend to use blood sugar a lot better, sort of suck up the blood sugar better for a full 24 hours after you've exercised.
Okay. So what would be the target, and everybody's going to be at a different fitness level, but let's say somebody who was recently diagnosed with diabetes, they're probably overweight, they're tired, they haven't exercised in a while, and so they decide they're just going to walk. What would be their target to walk, like, every day? Depending on their fitness level, and certainly they should check this out with their healthcare provider, and for some people with diabetes there's some issues with feet, so that's something to talk to a healthcare provider about. But in general, a half an hour every day is the goal. But you don't have to start there. You just need to start moving in some fashion. Okay. In whatever amount they can do, and then slowly build up. But a half an hour every day of exercise would be a goal. Okay, great. And then with the foods, like you had said, the non-starchy vegetables, so, greens, well, cucumbers are green, but just anything that's non-starchy. Now, are tomatoes considered a fruit or a vegetable? We actually consider those to be a vegetable, and non-starchy vegetable for diabetes. They don't impact the blood sugar very much. And so generally tomatoes are fine. We try to keep things as simple as possible at first. There are definitely advanced techniques for diabetes, but you have to start somewhere. And so the easiest way to do it is just to separate out, these foods are carbohydrates, these foods are not carbohydrates. And all those non-starchy vegetables you're talking about, things like greens and lettuce and cucumbers and green beans and broccoli and cabbage, and the list goes on and on and on. Eggplants and zucchini, and I mean just about everything in the produce section except the starchy vegetables. You really don't have to pay a whole lot of attention to how much you eat of those. And carrots are fine too. I always get that question about carrots.
that's fine too.
Okay, great. All right, well, we are just about out of time, so is there one last tip that you would like to get across to the viewers?
I think that it's important that if you suspect you may have high blood sugars, to make sure that you talk to your healthcare provider about that, to be screened for diabetes. And also know that there are things, you have a lot of power to influence your blood sugars. And so whether you're preventing diabetes or you are improving your diabetes, it's important to realize that you can really make a difference in your own health by changing your lifestyle and working with your healthcare provider.
Well, thank you so much for sharing this information. I think it's a lot of great information that some people just don't know. If you want some additional information, you can go to the American Diabetes Association website. The URL will be up on the screen for you. So remember that if you want some additional healthy living tips and tricks, you can visit my website at www.VeggiePatti.com. And I just want to remind everybody that no matter the cards you were dealt or your current state of health, you have the power to take charge of your health. So never give up and never stop learning. The solution you seek may be just around the corner. And Katherine, thank you again for joining me. And if you would like to join me for a final toast to the viewers, we'll have our non-carbohydrate juice, which is perfectly acceptable. We wish you a wonderful today and an even better tomorrow. Here's to your health.